For what purpose does the gentleman from Georgia rise? The gentleman from California, I apologize. For what purpose do you rise?
I'd like to address the House for 1 minute.
The gentleman from California is recognized for 1 minute.
Thank you very much, Mr. Speaker. If you want to know the ultimate option, open up this bill and look. You are required, as an American citizen, to buy a health insurance policy that has been okayed and only okayed by the federal government. If you don't, you could pay a fine, and if you don't pay that fine, you could go to prison for up to 5 years. Where's the public option? Well, if you're in prison, you're going to get free medical care. I presume that's the ultimate tragedy in this bill. We are changing the relationship of individuals to their government. Now, for the first time in history, as a condition of remaining in the United States, you must purchase something the federal government requires you to under the pain of a fine up to $250,000 and 5 years in prison. What kind of freedom is that? What kind of public option could that possibly be?
For what purpose does the gentlelady from Ohio rise? The gentlelady is recognized for 1 minute.
Thank you, Mr. Speaker. This is an historic day and a very exciting day as we move towards a vote on a bill to make health care affordable and accessible for all Americans. Like you, I've been listening to my constituents, and I've been hearing their stories. Even last night, I got a call from a friend. Steve, after fighting off lymphoma, got a notice from his insurance company that the policy for his law office was now being canceled, giving him a lot of insecurity about what his future would be and the future of the people who work for him. This bill would end that kind of discrimination, the discrimination against people with pre-existing conditions, and provide security to millions of Americans. Americans like me with multiple sclerosis and many of us with other pre-existing conditions. This is a moral issue for people now who will be able to access our health care system. Mr. Speaker, it's a very proud day to be able to take this historic step and end this discrimination. Thank you.
For what purpose does the gentleman from South Carolina rise?
Speaker, I ask permission to address the House for 1 minute, revise and extend my remarks.
The gentleman is recognized for 1 minute.
Mr. Speaker, Speaker Pelosi told the American people that the misnamed stimulus bill would immediately create jobs and keep unemployment under 8%. However, unemployment has now topped 10% with 2.8 million jobs lost since the misidentified stimulus was signed into law. Despite these staggering numbers, Speaker Pelosi continues to push a job-killing health care takeover. Clearly, Congress has a case of misplaced priorities. Patricia Owen lives on Hilton Head Island and owns Faces Day Spa. She is just one of the many small business owners who will be negatively impacted if this takeover is passed. With 23 employees of Faces Day Spa, the Owen family appreciates its dedicated staff. The Owen service-based company will face more punitive taxes in Pelosi's health care takeover. In conclusion, God bless our troops, and we will never forget September 11th and the global war on terrorism. Thank you, veterans, for victory in the Cold War 20 years ago Monday with the fall of the Berlin Wall.
For what purpose does the gentlelady from California rise?
Request permission to address the House for 1 minute.
The gentlelady is recognized for 1 minute.
Mr. Speaker, today is indeed a historic day, a day we can all be proud that on behalf of the American people we are doing something. So what is it the American people are going to get? Well, if you're a senior citizen in America, you're going to have $500 more in your prescription drug benefit. You're going to be able to get your drugs that are brand name for 50% less if you're in the donut hole. And by 2019, that donut hole will be terminated. What's in it for young people? Well, if you're good to your parents, you can stay on their health insurance until you're 27. And how about for women? For women, you are no longer going to pay 140% more for your health insurance than a man of the same age. And by the way, you don't have to fear getting pregnant because health insurance will cover your pregnancy. And for everyone else in America, we're going to be paying $1,400 less a year in uncompensated care. There is nothing to fear. There is much to be jubilant about. I yield back.
For what purpose does the gentleman from Louisiana rise? The gentleman is recognized for 1 minute.
Mr. Speaker, indeed this is a historic day. We have a choice today between two bills. One, which will have a government takeover of 1/6 of our economy, which will involve the federal government into the day-to-day lives of each and every American, or the Republican alternative, which actually goes to the central theme of the problems that we deal with today. Not only that, but senior citizens will be the most hurt by this government takeover of health care. $500 billion taking out of Medicare, and with not one scintilla of evidence as to where it's going to come from. It will come from access to care, of course. Furthermore, the CBO says that Part B will increase by $25 billion and Part D premiums by 20%. I would say in closing that God help us as the government takes over your day-to-day life.
For what purpose does the gentleman from Tennessee rise?
Speaker, to address the House for 1 minute.
The gentleman is recognized for 1 minute.
Thank you, Mr. Speaker. Today is indeed an historic day. As the plaque over the Speaker's rostrum says, in our time and our generation, we should do something worthy to be remembered. That was Daniel Webster's words, a man who served in this House. And we can fulfill the destiny of other people who served with us in federal government, from Teddy Roosevelt to Franklin Roosevelt to Harry Truman to Hubert Humphrey and to the recently late Senator Ted Kennedy. This is an important date for America. When we bring us into the 21st century, we should have been here 50 or 60 years ago. It is wrong that our country has an infant mortality rate equal to third world nations, and this bill will set out a newborn program that will try to rectify that. It'll see that private practice doctors go into the inner cities, with general practitioners having an incentive to go there, with community health centers in the inner cities, and wellness and prevention programs not having a deductible. It will bring America into the 21st century. Mr. Speaker, I am proud to be a member of the United States Congress, and never prouder than this weekend. Thank you, Mr. Speaker.
For what purpose does the gentleman from Florida rise? The gentleman is recognized for 1 minute.
Thank you, Mr. Speaker. I come today to ask a question. Why do the Democrats come to the floor to belittle the hardworking people who protest this government takeover of health care? They paid their own money. They drove their own cars. They weren't bussed here by the DCCC or the unions. They came to say, listen to us. Listen to us, Madam Speaker. We don't want a government takeover of our health care system. They don't want their children's future mortgaged to foreign countries. They don't want people who are not here legally to receive free health care. They want what the Founding Fathers in the Constitution wanted and guaranteed: freedom. What a novel idea. Freedom. I yield back.
For what purpose does the gentleman from Ohio rise? The gentleman is recognized for 1 minute.
Mr. Speaker, there's a lot of talk about freedom and liberty over the last couple days in Washington, D.C., but the question really is, the person who is sick and can't get health care, are they really free? If you keep getting sick because you can't access a doctor, you can't get better, so you can't go to work, so you can't make money, is that person really free? In 2009, we need to redefine freedom. And freedom in America in 2009 means being healthy and having access to a health care system that isn't just for the elite, but it's for everybody. Now, our people are going to get a 15, 20, 30% increase. Businesses are going to get a 30% increase right now. This is what we're trying to prevent. An $1,800 increase for the average family of four if we do absolutely nothing. We're going to wake up in a few weeks in America. No more denials because of pre-existing condition. No more people in America or families in America will go bankrupt, and we're going to fix this health care crisis that we have in this country.